Let's go to central London. We can talk to Dr. Peter Carter, Chief Exec and General Secretary of the Royal College of Nursing. Dr. Carter, good morning.
Good morning.
What do you make of this advice?
Well, we welcome it. We think this is a very helpful consultation that NICE has produced. We've actually worked with them on this. And I think for the first time, it will get some rigour into staffing levels in wards and other clinical departments, which to date has been sadly lacking. You make reference to the 1 to 8. Research demonstrates that once you go over 1 to 8, serious problems begin to kick in. However, having said that, we don't want 1 to 8 to be the benchmark, because there are plenty of clinical settings, neonatal units, intensive care units, where at times you need 1 to 1. But however, this is a very welcome start.
But what are the figures in terms of getting staffing levels up to a point where you can do 1 to 8? Is this something like a shortfall of 20,000?
Indeed, and what we have to do in the UK is to come to terms with the fact that compared to most Western European countries and the United States of America, we have far less nurses than those countries. And what the government and employers have to come to terms with, if you want safe and satisfactory standards of care, you have to invest in the workforce. And we've copious examples, particularly on wards for older people, where you get one nurse for 12, 14, sometimes 15 patients. Now, these people need total nursing care, and it's impossible to provide that if you have that ratio of nurse to patient.
But with a current shortfall of, 20,000 and a bill of 700-odd million, not to mention the time lag of getting those figures up, is the Royal College of Nursing saying then that at the moment, in wards across England in the NHS, you are going to get, by its very nature of the shortfall, inadequate care and, to use your words, unsafe and unsatisfactory care?
Indeed, and the problem is...
What you are saying, that is the case now.
What I'm saying is this: it is hugely variable, and whilst there's lots of very good care, there are undoubtedly many clinical situations each day when nurses are really struggling to provide the level of safe and satisfactory care that they would wish to do. And it's particularly felt in wards for older people that require total nursing care. And nurses tell us they often come off shift knowing that they've not provided the level of care that they would wish. And it's undoubtedly the case that there are occasions when patients are left in discomfort, sometimes incontinent, unable to change them for considerable periods of time, which adds to distress. So what we want to do is to work with the government to come to terms with that's the reality. It's not because the nurses don't care. There are simply insufficient numbers of them. And the government have had this evidence from the Robert Francis inquiry, Bruce Keogh, Berwick, Cavendish. All of these inquiries, one of the common denominators are there are insufficient staff. So let's not argue with each other. Let's come to terms with the fact if you want safe and satisfactory care, you have to have the requisite number of nurses.
Well, if that number is 20,000, that can be debated. But if that is the number, an additional 20,000, how do you recruit them, how do you train them, and how do you get them in place quickly?
Well, this may surprise your viewers. Despite the hammering that nursing has had over the past 2 years, there are broadly 25,000 training places each year. We still, amazingly, have lots of young people and mature people want to be nurses. There are actually 225,000 applications for those 25,000 places. So you've got a 10-to-1 shot to get in. So people do want to be nurses because they know it's an incredibly satisfying career. And you do have to invest. I mean, people think that the NHS simply sucks in money. We spend less as a country than most Western European countries, and we actually spend about half of our GDP that America spends. We spend about 9%, they spend 18%. Invest in more nurses, and what you'll end up with is better care, more efficient care. It makes good clinical sense, but it will make more financial sense, and I'll briefly say why. Because cheap care is poor care, and poor care costs more money, so you actually invest to save.
Dr. Carter, thank you for your time this morning.